Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN, Healthy World, Healthy Nation, Healthy You. I'm Nancy Valentine, PhD and registered nurse, and this show is dedicated to you, the healthcare consumer. And today we're having another installment in our series on autism spectrum disorder. And we are going to be really turning the tables on this one to a certain degree. We're going to be talking about the role of healthcare professionals in the care and treatment and an understanding of the autism spectrum disorder. Now, if you are listening and you are in the healthcare field, this will be of great importance to you. If you're not in the healthcare field, I think you will also find this very fascinating, because as you are involved with the healthcare system and say you have a child or you know someone that is getting treatment who has autism in the healthcare system, I think it will be very heartening to learn that there is a whole program being developed to help people be better practitioners and more sensitive to this very difficult disorder, something that a lot of people don't understand, even if they're healthcare professionals, because autism spectrum disorder is a neurobiological disorder, and it has, as the word spectrum indicates, a broad range of typical behaviors, and we're going to be talking about that and how we can best deal with them as healthcare providers. And the person that is really going to guide us through this discussion is a really renowned person in her field, Dr. Ellen Giarelli. And Ellen has done another show with us on parental parental guidance of children with autism, but she has real expertise in working with healthcare professionals. So let me give you an idea of what her background is and why she is so well prepared to do this work. She is the associate professor in the doctoral nursing program at Drexel University School of Nursing and Health Sciences. But most importantly, she developed a program previously when she was on faculty at the University of Pennsylvania School of Nursing, and developed a certificate program in integrated nursing care of autism spectrum disorder. And she's going to be talking about that program. She then moved to Drexel University, and she is directing a similar program there. So this is wonderful. We have 2 programs like this in the region that are really helping to guide nurses, but the information that she's going to be sharing really goes well beyond just nurses. And her other claim to fame is that she has written the only textbook, Nursing of Autism Spectrum Disorder, a textbook that she has developed really as a guideline for nurses to really be excellent in caring for people with this problem. So I want to welcome Ellen back to our table and to our discussion, and I know that this is going to be of great interest. I'm interested in this because if you're a nurse, a doctor, a dentist, I mean, it doesn't matter how you're practicing, you are going to run into people that have these problems. And to be the most effective, you do need some additional training. So tell us about your program. How did you get started with it? How does it work? Just give us an overview of it.
Thank you, Nancy, for having me today. This is delightful to give an opportunity to talk about this very important program, as you say. Mainly, I guess I have to remember the experience that my sister had. She has a son who is on the spectrum, and she struggled for years with accessing healthcare services that were appropriate for her son. And that's her experiences sort of gave me the idea that there is a cohort of health professionals that we deal with on a day after day who have no idea what autism spectrum disorder is,
right,
and how to integrate, how to blend their understanding of this disorder with the care that they give on a daily basis,
right,
regardless of where
right,
they practice their
right,
profession.
Now you might ask yourself, like, why is that? Why don't people have more knowledge? Well, in the wide world of sports, meaning when you go to school, whether it's nursing school or medical school, there are so many things to learn that the curriculum is very crowded, and it's really hard to get into some of these other kinds of disorders because there's just not a lot of time in the training programs. And so you really have taken up that gap and addressed it.
Well, that's true. That is true. And one of the things we did before we developed this program was to look at the nursing curriculum in different schools, different program levels, baccalaureate, which is the 4-year, and then the master's, which is more advanced, and look to see if there was any time available in that very dense, compressed curriculum to put more information, more specific information about this population, because there wasn't, naturally.
Right.
So thus the need to develop something entirely separate, standalone, that focuses on this particular cohort of patients and then what nurses must know to deliver best practice care wherever that patient appears in the system.
Right.
And there you have it. There's our program. So the program is a 4-course curriculum. The one at Drexel University in our College of Nursing and Health Professions is a post-baccalaureate, which means that a nurse must have completed 4 years of nursing training before she can get admitted into this program. It's a post-baccalaureate certificate, so at the completion of the program, she gets a certificate that says, or he or she gets a certificate that says that they have expert knowledge in caring for people with ASD, and that they know how to blend that knowledge with the care that they give, whether it be in the emergency department, pediatric primary care, post-operative care, or any place where that patient appears for medical or nursing interventions.
Right, that's great. I think that's just so admirable that you put this together, because there is a gap. And tell us about the students. Who was attracted to this program?
Well, we have everyone. Everyone seems to be attracted. Our population of students is growing in leaps and bounds. We started in the winter quarter, which began January at Drexel, and our nursing students were, some of them were in master's program to become nurse practitioners, pediatric nurse practitioners. Others were employed in emergency departments. There was one nurse who came from Rhode Island, and she was an advanced practice nurse caring for the elderly patients in clinical settings. We have pediatric nurses from CHOP, and we have a nurse from upstate New Jersey who is working in a mental health care facility and wants to increase his knowledge of this population. So our program appeals to any nurse who believes that they must know about this patient with ASD in order to give the best care.
That's great. So even though we use the word spectrum, meaning the disorder itself, that there are some mild versions of this disorder and there are some very severe, there's also a spectrum of practice settings. So I think that Ellen's saying that this is very appealing, and again, not just for nurses, even though this program is targeted for nurses, but this discussion is targeted to everyone in the healthcare field. It doesn't matter where you practice. Like you said, some people are in geriatric settings.
Well, exactly. And I usually introduce the first day of our classes by saying that 1 in 88 children in Philadelphia and in the United States are likely to be diagnosed as on the autism spectrum. And that means that 1 in 88 of the patients that you might take care of are likely to be on the spectrum as well. We have no idea when that patient comes through the door sometimes if they have autism spectrum disorder, but we teach the students ways to identify what kind of care needs to be changed in order to treat them properly. So essentially I say that sooner or later, every nurse is going to care for a patient wherever they're practicing who is on the spectrum.
Right. And I think it's admirable that there are so many healthcare professionals, in this case nurses, that are really interested in pursuing this certificate. It just shows how nurses are really burning with desire to really have more information, more knowledge, and to be better at their craft. And it's a lifelong learning profession, so there's always opportunities to learn more. So maybe some people that are listening would be even interested in finding out more about this program, and that information will be linked to the website, so you can go to that for more information. But I think the beauty of this discussion with Ellen is that we're not going to take the course necessarily, but she's going to really provide us with some of the highlights of what she teaches. So why don't you walk us through that, Ellen?
Well, why don't we pull up that first visual,
okay,
and then I'll tell you the key points of what our students are taught in multiple courses across the certificate. We teach our students how to create a therapeutic encounter, which means that we want our students to be able to change the way they interact with every patient who comes through the door who has ASD and needs their care. The first thing they learn is the symptoms and the other features of ASD, or autism spectrum disorder. They learn what the core characteristics are, what kind of associated features they have, their particular issues or special needs. Then we teach nurses how to predict how their understanding of the patient's problems will interfere with the kind of care that they have to deliver to their patient, nursing care or medical care. And then we teach them how to identify the specific barriers to delivery of care, and then how to remove those barriers so that that patient with a broken arm, who also has autism, will be given the best treatment possible. And to bring it up one more time, I just want to show you, give an example. On the bottom of the screen, you'll see a rating scale that we teach our students to use. It's very simple and very direct. It's sometimes our patients can't tell us the kind of pain that they're having. So we use a visual and ask them to point to the very smallest little restricting box if they have no pain, and if having very much pain, point to the very red, very intense, very large container that is binding them as they're experiencing this nursing treatment.
I'd like to just comment on that, because one of the features of this disorder for some people is that they really have very limited verbal ability to describe how they're feeling or their thoughts. So yes. I think that's really a very basic visual on how to cope with that, by not expecting that and demanding that they speak when they can't, but giving them an alternative so they could point to it. And does it work?
Right.
Does it work?
Absolutely works. And even just a simple reminder to nurses that a person with ASD is not likely to look you straight in the eye when you're telling them how to use that instrument after their surgical procedure. But so a nurse will know that they shouldn't expect a patient with autism to attend to the nurse in the same way that another patient might. So we learn these little tricks, we teach them little tricks, and we teach them how to use these visuals that I showed you in order to establish a therapeutic rapport or relationship.
Right. How does that work, though, with someone who diverts their eyes, and that is something where they really can't look at the person directly? How does the nurse or the doctor or whoever we're talking about in that encounter, how do they really explain things to someone that's not looking at them?
Well, the assumption is that because they're not looking at you, that they're not listening, but that's an incorrect assumption.
Okay.
It's just simply not true, because we know that a person with ASD, and I'll show you how they might react, they might look up and look around, but we know from our experience with them that they're listening to every word that you're saying, that they understand exquisitely, and can even sometimes repeat word for word what you just said to them. So our expectations have to be changed. We have wrong expectations.
Right. Well, I think what you're saying too is that we have to adjust as healthcare providers. It's not really expecting that this child or this adult can really adjust to us. We have to adjust to them based on knowledge, based on what you're teaching people.
Exactly. And one of the other main perspectives that we teach our students is we try to help them, as we're just talking, you'll see what I mean, to see through the eyes of the person who's affected with autism, to apprehend or try to understand at its most fundamental level what they're going through when we bring them into a hospital, or we walk them through an emergency room, or we even ask them to talk to the doctor and tell them how they're feeling. We try to help the nurse to see through the eyes of that patient so that they can truly understand what kind of care needs to be provided.
Right.
Maybe we can bring up that
Let's
visual to do that.
Let's walk through some examples of that. Okay, what are we looking at here?
So here, and thanks to Dr. Romy Nacero, who is the clinical director of research at the Hahnemann University Hospital Emergency Room. She took some photographs for our use today. Here's a photograph that I'd like you to tell me what you see, Nancy.
I see a waiting room waiting to have people come into it with a lot of chairs, a TV, and some pictures, and it looks sort of lonely.
Yes. So if a nurse were to be asked to see through the eyes of the person with autism, they might say that though a person who desires different kind of structure and order to their environment, the person with ASD might want to go into this area and rearrange those chairs in a different way so that it's more comfortable for them. They might see the orange color of the walls as being very intrusive and very unsettling to them. They may see those chairs, even if they're filled with people, as being a threatening environment and want to turn around and walk right out of there.
Right, because one of the features for many people with this disorder would be a sense of losing control walking into a place like that.
That's right.
And that would increase their anxiety, and because they're anxious and fearful, would accentuate these behaviors.
Mm-hmm. And their fear of social encounters might mean that a wait in the waiting room of an emergency department could be intolerable for them. And think about it, that's where most emergency room patients spend the majority of their time in the emergency department. They spend it waiting to be seen, to be treated.
Right. I think another thing to keep in mind is that when people with this problem come through the door, they don't necessarily make an announcement like, "Hello, I have autism, so figure out how to take care of me." It has to be where they come with this, like other people come with other problems, and it's really up to the healthcare providers to sort of see those cardinal signs and be able to intervene, or maybe ask the parent if the parent happens to be there. But all these circumstances are very fluid.
And so we teach nurses that they might try to use a screening tool when any patient comes through the emergency department, for example. You're right in this respect that sometimes patients don't come with this information, but sometimes they do. But regardless, nurses can ask simple questions of the patient or the person who brings them in. They might ask, are you particularly sensitive to bright lights? Do you find crowded areas disturbing? Would you like to be placed in an isolated area? These simple questions could help the nurse to understand that that patient needs special consideration in order to create that truly therapeutic encounter.
Right. I think that's really great, because when you think about what I think most people experience, whether they go to a doctor's office or they're going to an emergency department, they're just sort of put in a room and then that's it. Nobody really asks them these screening questions for the most part. I think that's pretty much another step of sophistication in how to deal with people in general. Would you agree?
Yes, I agree. Do we have time to look at another
We certainly
picture?
do, please.
Okay, let's jump ahead to another photograph taken of a patient being brought into this treatment area. What do you see, Nancy?
Well, again, I see the same features that you pointed out in the earlier, and that is it's very bright, it's somewhat foreboding, because now not only are there no chairs necessarily, but there are stretchers. It looks, maybe for some people almost prison-like, like they're going across a threshold into an area where it could maybe be potentially locked. I mean, maybe we don't know what's going through their minds exactly, but it is intimidating. And again, along the spectrum of human experience, going into a setting like this is intimidating for anyone.
Yes, indeed.
So you're only talking about accentuating that intimidation for someone that already has a sensory issue where it's very difficult for people to make those fine differentiations.
And we had the advantage of looking at that emergency department room that's quiet and empty on a time when Romy could take a picture and nobody was there. But more likely, that person with the ASD will walk through that threshold and see monitors beeping, doctors and nurses hustling and bustling around, patients moaning on bed gurneys, and bright lights flashing, and people coming in and out with equipment and supplies. A very intimidating environment, as you said, for anyone, but even more so for a person who has difficulty understanding the conglomerate noise and differentiating one sound that's important from another, or there's visual clutter can be completely distracting and cause a person with ASD to act out, to have a meltdown, to possibly become aggressive, to resist treatment, and their behavior then becomes the fundamental barrier to the care that we need to deliver.
Right, because we're too busy as healthcare professionals trying to control the behavior. And again, as Ellen is pointing out, any nurse, doctor, anyone that's working in a busy ED has many people to take care of. So they can only have so much attention on any one individual. But in this case, maybe there are certain things that people can say. What kinds of things can nurses say to someone coming into an environment like this that might help to calm them down a little bit?
Well, whether it's a person with autism or a neurotypical person, what a nurse might want to always ask is, what can I do to make you more comfortable right now?
Right.
And that simple gesture, that simple request to hear you, to know what you need.
Right, to connect with you, connecting with you.
Can make all the difference. And if our patient with ASD is able to communicate their thoughts and feelings, be sure to accommodate them. You might even be able to not get a verbal answer, but just the visual response. The behavioral response that they give you to that question could be pulling back, trying to get away, avoiding your gaze, just trying to withdraw themselves from the environment. That message tells you that they need to be alone. And so the answer to the question is, what can I do for you? Could be, let's create a quiet room, remove all that external contraptions if possible, and put them away from the conglomerate noise and the clutter so that they can relax, so that you can treat them.
Right. That's very, very good. I like these pictures because they really do give us a visual of looking at things that we're used to as healthcare professionals looking at, but through that other lens. Do you have any others?
Well, one more I could pull up, and that's our final room. Let's see. Okay, what do you see, Nancy?
Well, I see another iteration of the ED where it's even more frightening, because somehow you're going to put two and two together that gurney is for you. And you're going to be on it for pretty soon, and all that instrumentation that's hanging off of the wall, somehow they're going to do things to you, and it's probably going to hurt.
Yeah. Now, looking through the eyes of a person with autism, maybe we could bring it back up again to take a look at again. So let's the audience try to see through the eyes of the person with ASD. A person comes into this room who likes to have everything lined up in a row, who likes order, and who's very technical in their special skills. Now, they might come into this room and find it disturbing that they can't change the display panel. They can't put one object in another place, and they have to leave it be, and they can't touch. They may want to look at that device on the left, which looks like to be a monitor, and they want to touch it, they want to play with it, they want to open it up, they want to deconstruct it and put it back together again, and they're forbidden to do that.
Right.
So this particular environment could not only be sensory disturbing to them, but could also be entirely frustrating to them as a person who has special skills, and they want to get in there and touch and feel and move around and manipulate things.
Right, and there are a lot of limitations in these environments.
Very many limitations,
right.
Yes.
But I like what you said to us, and that is how to really keep the connection with the patient and the family and anyone that is with that person, and just understanding and having that sort of open heart to what they're experiencing. It sounds to me like that is a very good technique for intervening more appropriately, rather than being frustrated or just wanting the person to calm down and giving them those kinds of signals and cues.
Yes.
I would think that for some healthcare professionals, it could be quite frustrating, and they may just leave the area because they don't want to deal with that person right now.
Right, and especially when the treatment that's prescribed, that needs to be provided, requires some kind of an invasive or a procedure, such as giving an injection or taking a blood sample. Nurses sometimes are required to get in and get it out as fast as you can,
Right.
and be efficient and speedy in
Right.
nursing care. And often that's not possible
Right.
with people who need to be eased into
Right.
a difficult situation.
Right.
So it's frustrating for nurses, definitely.
Right.
So we need to think differently
Right.
about care.
Well, part of our takeaways from this show is for you to be more understanding of what this disorder is to begin with. So I think that we've already heard from Ellen that she's been able to give us sort of some of the highlights. I think the second is to really have better interventions to really understand what we can do. What are those maybe even small behaviors that make, a really big difference? So I think in terms of wrapping up, just tell us what are some of the takeaways from your program that you think other people in the healthcare field can learn from as well?
Well, the first important message for the audience and for nurses is that there are many people who we will encounter day to day who are on the spectrum, who require that we understand who they are and meet their needs appropriately. And the second message is that parents and caregivers of older patients with ASD should expect that healthcare providers have this kind of information when they treat their affected family member or their charge. It's not okay to just shuttle patients through and give treatment as fast as possible without knowing and really understanding what a patient needs when they're
Right.
on the spectrum.
Right. I think that's very, very important advice, because to be delivering patient-centered care is really what we're all aiming for. And healthcare reform is emphasizing that even more and more. And for many of us, it is a shift. We think that we're being patient-centric, but when you really look at it through the lens, as we did today in this show, through the eyes of someone that has this particular disorder, they may not give us the highest rating because we're not using all these skills. And I think that what Ellen has done with her team is that she has really designed a program by having these 4 courses and all these clinical discussions with a wide range of nurses. She is really building the capacity of people in our field to be more effective in how they really deliver care. Now, I think the nurses are really getting a great deal with this certificate program. But what do you see as the future for the whole team in general? Where do you see this going, this whole knowledge base?
You use the word team. That's where it's going. In the past, educators taught in their own little silo of institutional silo. Doctors cared for them in their own little habitat, and we had behavioral therapists which just treated
Right.
the person with the autism. But we need to all come together as a team to plan care that is blended and we call integrated, so that we use the skills of our colleagues to enhance the kind of care that we deliver. So really the team approach that you
Right.
just mentioned is the future of the care of this patient population.
Right. So it sounds like these programs are going to have to expand to become interdisciplinary, which is another level of evolution of programs such as this. I want to thank Dr. Ellen Giarelli for being with us today to educate us. And again, this is just the tip of the iceberg in terms of all the knowledge that we could acquire to be more effective in this field. But I think that one of the things I'd like to acknowledge is that she is a trailblazer in the field of nursing, having really taken this on and developed it and brought together a team of people as well. So that that is part of what we're doing with this series, and she's been very helpful in putting this series together, because our goal is to bring this information directly to you as the consumer, whether you're the consumer as a caregiver, as a family member, or as our show today was emphasizing, if you are a care provider. We all can play a role in this, and we can all do a better job. One of the things I think is so enlightening and so heartening about this is that These are the kinds of people that in the past often could be institutionalized or shunted away in society in some other way. We are mainstreaming people like this, and it's really for the better for that person and for the better for the rest of us. I think it's all part of creating a village of intelligent people that can do the right thing. So again, Ellen, I want to thank you. I think we covered our key points today, and we hope that you will, as a consumer, if you are dealing with this, as she said, you have the right to expect that your care provider team is going to be knowledgeable and sensitive to these kinds of problems. If you are the care provider yourself, that you will have been piqued, your interest will be piqued, so that you will want to learn more about this and be more effective and also more tolerant when you encounter patients like this in your practice. So again, I want to thank our viewers for being with us. I hope that you learned something that you can take away and share with others. So thank you again for joining us, and remember, with health, all things are possible. Have a wonderful day. I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening, and join us again. And remember, with health, all things are possible.